A very good morning to Madam Arachelvi. We are pair 6 and today we will be presenting about our assignment which is the correlation of concept screening with survival rates. Okay, next slide. Before that, let me introduce myself first. My name is Muhammad Nazib bin Jeffrey and this is my pair which is Muhammad Afi bin Khalid. Okay, next slide. Okay, now we will move to the purpose. So basically there has two purpose for our presentation, which is the first purpose is to compare the survival rates between symptom detected as well as screen detected, and the second purpose is to compare the survival rates of early and late cancer detection. Okay, next slide. So here is the main issues or problems about our topics, which is the lack of knowledge and awareness about the early symptoms of cancer towards the community, society, and citizens. By this picture below, we can see that the major or common problems that always be a barrier to do an early diagnosis of cancer was the lack of awareness. This problem not just only happen in third world countries that has a difficulty to get and access on the information of the knowledge, but it also happens in first world countries too, such as UK, US, and any Middle East countries. So the IPAC survey explored the most common cancer among women in Europe is breast cancer. Yet, women are unfamiliar with the diverse early symptoms. Okay, next slide. Okay, so before we going more deeper about our topics, I would like to let you know first about the background of topic, central ideas, and the impact of early cancer detection. So, what is early cancer detection? Early cancer detection is a process of identifying cancer and at an initial stage, often before symptoms appear, to increase the chances of successful treatment and survival. Next is central idea. Okay, this presentation will emphasizing the role of early cancer detection in increasing survival rates and reducing the burden on healthcare system. Like I mentioned before, to increase the chances of successful treatment and survival. Why early detection matters? This is because early detection can give patients a much better chance of surviving and recovering from cancer, such as better quality of life, less aggressive treatment needed, and lower healthcare costs. Before I pass to Muhammad Afi bin Khalid, I would like to ask and know whether you or any of your close relative ever experienced the cancer.
Okay, when we're talking about self experiences, actually, my late mother passed due to the facts of cancers, which is breast cancer to be particular, and she was actually had both her breasts removed, but then again, the after effects of cancer didn't even end there, and it kept spreading to all parts of her body, and she was passed away actually last year. Okay, that was due to the fact of cancer itself. Okay. Uh, Next slide, please. Okay. This is the first, which is the graph itself. The graph actually was produced or even sourced by the MDPI of where they published into Cancer Journal. back in March 2024. The graph was actually deducted by breast cancer patients in Germany. The information was collected from breast cancer patients from 2000 until up to 2022. This graph actually indicates different kinds of cancer screening correlates with the survival rates. As you can see, the most highest survival probability would be of mammography screening, where they holds the most survival probability up until to the point of the next 15 years. And the lowest would be the symptomatic cancer, where they almost have only half or we can see zero point 0.5 survival probability for the next 15 years. Okay, next. Okay, next we move to the bar chart. The bar chart was actually a collected data that was produced by American Cancer Society 5 year data, which is based on diagnosis from 2011 to 2017. The bar chart itself indicates or shows six most common types of cancer and how early versus late screening affects percentages of survival. As you can see, the one in the orange one would be early diagnosis survival rates, and the blue one indicates late diagnosis survival rates. Okay, we can see over here. For if stage one, stage zero, or stage one early diagnosis, most cancer patients would have high survival rates up until most of it would be I mean like over 90 percentage of survival rates. However, for the blue ones we can see over here, if the diagnosis was done at stage 4, the survival rates wouldn't even, most of the time didn't even exceed 50 percentage itself. Hence we know that time is crucial in the matter of survival rates for cancer survivors. Okay, for the conclusion itself that we have made is that each kinds of stages of people, government, and also health institutions really matters the most in terms of make sure or even indicates or even educates people on the screening methods of cancers itself, due to the fact if having early screening would ensure that they have the higher possibility of surviving. However, if late screening itself would indicates that they have lower survival rates, and health institution really matters the most when in the or in terms of knowledging or even educating people, and government also should push the health institutions to make sure that for the people itself to have better future later on. Not to mention, individual itself should have a proactive measures taken, which they should, you know, uh, involve in terms of cancer screening, with the thought of that they may have cancers later on. Okay, next slide. That will be all by me. Thank you very much.